Meanwhile, China is providing an update on the coronavirus outbreak, and we will cut across live.
Their own family life to contribute to this battle against the virus. They try to protect our people's health, and they contribute a lot. We extend our respect to them. Now is in the critical period of the battle against this virus. We are still facing very challenging situation. The society, we need to care more about our medical workers. We need to unite as one to conquer these difficulties. We should resolute to win this battle against the virus. Next, I'd like to give the floor to Madam Guo Yanhong to introduce to us more about how we can implement our responsibilities for the prevention and control of the epidemics. Dear friends from the media, to implement the control of the epidemics is directly related to the safety and health of our Chinese people. Central government, State Council pay high attention to this. They have a serious deployment, and also people from all walks of life unite as one to devote to the combating of this battle against the virus. And we try to contain the spread of the disease and epidemics. We try to allocate medical resources, optimize the diagnosis and control of the disease, and we also enhance our management of those designated hospitals. And we also fasten the research and development of the cure and also of the medicines. Currently, we are in the critical period of the prevention and control of the outbreak. To implement the responsibilities, we need to have concrete targets. We need to try to understand our weak link and our strength as well as the limitations. We need to have more practical and comprehensive redeployment and further requirement, thus to improve the admission rate and cured rate and try to reduce the infection rate and mortality rate, thus to protect the health of our people. We have the following measures. The first one is what we call 4 principles of early identification, early report, early quarantine, and early treatment. We need to find those individuals affected in a timely manner. We also need to stick to the prevention first and enhancing the grade-based management system among the communities. And we need to try to improve the testing capability, shorten the confirming cases time, and thus to effectively cut the spread of the disease. Secondly, we need to support the medical supplies to Wuhan and to Hebei province. We support them as much as possible. We dispatch the medical workers to work in Wuhan and Hubei, as well as other counties and cities. We have already sent more than 10,000 medical workers, including doctors in the field of severe patients, as well as the respiratory disease-related experts. And also we have the national implementation policy, try to increase our management for those fever patients, close contacts, as well as the confirmed case, and we implement the quarantine policy as soon as possible. We make sure they receive the treatment in a timely manner. We also have the 4 centralization principle, namely the centralization of patients, experts, resources, and treatment. We also try to centralize those severe patients into the most competent hospitals, and we try to centralize those medical resources, and we also have a patient-based and case-by-case cure protocols were the options, thus to reduce the mortality rate effectively. Number 4, we try to research into some methods to cure the disease. We try to apply those effective methods in the clinical practice to save more patients. In particular, we try to play the full strength of the Chinese traditional medicine, and we improve the sensitiveness of those reagents, as well as the development of the vaccines and new methods. We try to improve the cure methods to improve the cure rate. At the same time, we try to implement this mandate locality principle. We try to stop the import and export of the disease, and we try to contain the virus. We have the law-based implementation of such prevention, and also we try to enhance our inspection and accountabilities of this job. Next, we will implement our central government strategy and deployment. We will increase our awareness of responsibility. We will be accountable. We will implement all the measures. We are resolute to win this battle against the virus. Okay, now let's come to the Q&A session. And as for the journalist, please tell us where you're from before you raise the question, please. Thank you. CCTV. President Xi Jinping mentioned that we need to increase the admission rate and the cure rate, reduce the infection rate and mortality rate. So there are 4 tasks. What kind of measures we already take, and what are the difficulties to reach these goals? What are the countermeasures for the future? Okay, I'd like to give the floor to Madam Guo Yanhong, please. Okay, talking about the reduction of infections rate, we try to implement all the prevention measures. In particular, we give quarantine to all the suspected cases, patient, and we improve the health promotion as well as their capability for receiving new patients at the community level. And also, when we identify a patient, and then we need some time for the determination of a suspected case and the confirmed cases. We try to shorten this process. We also stick to the principle for early identification, reporting, treatment, and quarantine. And we also enhance our management of fever clinic as well as the hospital management, and take early identification is a very important measure. We also have the centralization principle. For example, we try to transfer those patients into some designated area or hospitals to enhance their admission capacity. And according to the improved cured rate, we optimize our options for treatment as well as the guidelines for the treatment. We are now develop our treatment protocol into version 5. We try to summarize the experiences we gained during the process, and we also try to enhance the strength of the Chinese traditional medicine. At the same time, we add the strength of the Western medicines. At the same time, we try to allocate the medical resources from all over China. In Wuhan and the Hubei province, they have the most patients, so they need help from the medical workers from other provinces and municipalities. So we actually have this nation-based allocation of the medical resources. As for the reduced mortality, we try to give better treatment for those severe cases. We have 4 centralization principle: patients, experts, resources, and treatment. So these are the principles focusing on the rescue of the severe patients, and we also centralize those patients into the most competent hospitals. We have a national level expert team, high-level expert team, which led by academician Zheng Nanshan and other academicians, and they try to enhance their supervision for the treatment of severe patients. At the same time, we have a real-time monitoring of the gap in Hubei and Wuhan to see if they need the resources. We just try to support them. And also, we pay high attention to the protection of the medical workers. No matter during the diagnosis options or in other steps, all our experts try to give support to the medical workers who work in the front line to reduce the risk of infection for those medical workers. Now we are in the critical period of this battle. We are confronted with a lot of difficulties and challenges. In particular, in Wuhan and Hubei province, we have increasing number of patients, but the limited resource of the medical support. And some of the people, during the process, they visit doctors. They are also encountered with a lot of difficulties and challenges. And also, as I mentioned, we have the principle for early, and we try to control infection into a minimum scope. So we need to do the job at the macro and micro level. At the same time, for this, the novel coronavirus is a new virus, new disease. It takes time to understand the spread of the virus and the treatment of this disease. We try to develop the measures to address this.
So these are the difficulties we are faced with. As the next step, based on these four principles of identification, reporting, early treatment, and early quarantine, we are going to focus our medical resources on the treatment and diagnosis to increase the cure rate, and lower the mortality rate. Thank you. Thank you. From China Daily. Why we put in place this mobile hospital? Whether they are accommodating, meeting the needs of the patients, and what criteria they will be discharged, and what kind of situation will prompt them to be transferred to other hospitals. But do you think, in these hospitals there's a risk of cross-contamination, and also in areas, in these hospitals, where thousands of patients stay together, they are under a lot of pressures. Do you think that you are going to replicate this shelter hospital or mobile hospital into other cities? Mr. Wang? As I said at the outset, the big challenge in Wuhan is the increasing number of the patients and limited resources, medical resources on the other hand. That's why this shelter hospital is designed to accommodate and admit more patients so that those confirmed